Hey guys, Chris here from Lifeline EMS Training. We're going to go through our next case in our What Would CAPNO Do series. This one is sepsis. CAPNO actually does a couple things in sepsis. When we look at sepsis, we commonly look at SIRS criteria. So it's the systemic inflammatory response syndromes, the body's response to an insult, usually seen in trauma, burns, sepsis. So what happens? Well, we spike a fever, try and make a suboptimal environment. Maintaining that fever, though, so we have to have a high metabolic output to generate that heat. So we can only sustain that for so long. So late sepsis or cold sepsis, the actual temperature goes down. So heart rate at or greater than 90 sustained, because again, catecholamine response, increased metabolic output, increased RPMs of the heart. Respiratory rate greater than 20, that has to do with a couple things, trying to draw fluid back up and also trying to introduce oxygen into that high metabolic circuit. And then we have the elevated or low white count. Infection plus 2 of the SIRS criteria, likely for sepsis. The sepsis stages, so sepsis is infection plus SIRS criteria. Severe sepsis is sepsis with organ dysfunction, so change in mental status, trouble breathing, poor kidney function, reduced urine output, abnormal liver enzymes all count. And then septic shock is sepsis plus hypotension. That means that MAP less than 65. So high metabolic problem, when you see that heart rate and the end tidal both going up, think high metabolic issue. So high metabolic output, stress response, stimulant, PCP, Coke, somebody who's hyperdynamic. So that's what we see early in sepsis. What we see is we see that high heart rate and that high end tidal because the person has increased metabolic output trying to combat that infection. So you'll see a high or on the upper end of normal end tidal value along with tachycardia. They're ramping up, generating heat for the temperature, stress response, cortisol is being released, glycogen's being broken down, increased sugar to sustain this. You'll start to see them breathing on the faster end of normal. Really, once we start to get that rate above 20 on the respirers is when we start to think that they're transitioning to a worse degree of sepsis. So when we see the heart rate going up, but the end tidal going down, we should have high suspicion of perfusion problem. Cardiac output, heart rate times stroke volume, and septic shock. The person's acidosis is going up, blood volume is going down, container size is going up from the nitric oxide production, and their heart's getting floppy because of the acidosis. That's why the heart rates are so high in septic shock. So what do we see? Well, we see that heart rate go up like we talked about, and we see that end tidal go down. The end tidal is going down because perfusion is going down, as well as the amount of free-floating bicarbonate from the kidneys is going down from the sustained high metabolic output. And remember, bicarb plus hydrogen equals H2O and CO2. So when the bicarbonate goes down and the perfusion goes down, CO2 plummets. And that's really when we see people in severe septic shock. When that end tidal really gets below 24, that's a bad day. That's what CAPNO would do in this case for sepsis. We hope that helped. And as always, if you have any questions, hit us up at info@lifelineemstraining.com. And we hope you have a great day.